My name is Charlene Harris, and I'm going to discuss my practicum that I am working on at Alliance Behavioral Healthcare. Alliance Behavioral Healthcare is located in North Carolina. It is a managed care organization that coordinates care for people with intellectual developmental disabilities, mental health and substance use disorders, as well as people with traumatic brain injury. At Alliance Behavioral Healthcare, because they are working to increase the quality of care for people with disabilities, they have chosen to focus on at least many of social determinants of health. But the project that I worked on is the medical care social determinant and making sure people with disabilities are receiving their primary care visits. A primary care visit is essential in improving the quality of health among all individuals, so especially those with developmental disabilities and other disabilities, because they often have an increase, because they have higher rates of high blood pressure, diabetes, gastrointestinal diseases, and other diseases that they may not be able to express to a doctor. So it's important that they find a medical home and that they attend visits so that they are able to, so that the doctor can identify issues, and at a medical home they can get continuity of care. So while at Alliance Behavioral Healthcare working on the practicum, I worked on creating a tool that can be utilized to identify people who are not receiving care from a primary medical care from a primary care physician, or people who are not receiving any medical care at all. And once those barriers are identified, then we can move forward with finding resources for people who need to access medical care, but may not know how, or may need assistance with doing so. So with that, we modified one form that was already available at Alliance Behavioral Healthcare. It is called the Risk Supports Needs Assessment Form. And on that form, there are all sorts of risks that can be identified for individuals with intellectual developmental disabilities, mental health or substance use disorder, or people with TBI. The part that I focused on was the section that identified whether or not that person was receiving care at all within 1 year of using this tool. Did they go to a primary care visit? Did they go see a psychiatrist? Did they go see a dentist? But mainly it was focused on if these people went to a primary care visit. So that information was documented on that form. And if it was documented that the individual did not receive primary care, then a primary care verification tool that was developed was used to identify the barriers to people receiving primary care. Was it access? Were they did they not have access to a primary care physician because they did not have a provider? They needed assistance with finding a provider. Was it transportation? Had they declined the service? Were they afraid to go? Once these barriers were identified, then a healthcare toolkit would be used to assist those individuals. Like if someone was afraid to go to the doctor, did they need more education on going? Did they need encouragement? Did they need support to attend? If it was transportation, did we need to provide them information on how they can access the bus for free or to low discounts? So that toolkit would be created and provided to this individual. And so throughout the process, data would be collected monthly to see people to identify people who had no primary care physician or who had not attended an appointment, people who had a physician or had attended an appointment within the last year, and people who did not know, because often people who have disabilities cannot remember if they had actually seen a physician or not. And so therefore they may need some assistance with communication and increasing their communication once they did attend a doctor's appointment. So the data that was collected would be used to identify others in the, to identify any type of barriers, others who may need the support, because we would look at that data to look and compare to the other population. So throughout my time at Alliance, I did collaborate with managers and stakeholders to focus on the significance of primary care visits and people with disabilities. And as a result of that collaboration, we did develop the tools necessary to be able to monitor if someone was seeing a primary care physician, as well as developing a tool to actually follow through and have ongoing monitoring to address the issue and provide the supports needed for people. And also during the practicum, I was given the opportunity to attend a leadership training that focused on strength-based leaderships and how those leadership skills could be used throughout the organization. And I also was given the opportunity to work in a work group where I led individuals on how to use the risk support needs assessment. How will new employees be trained on the risk support needs assessment, and how we can maintain an ongoing training to ensure that people are using the assessment, using it correctly, and that all new employees receive the training to use the risk support needs assessment, as well as know how to continue to do the monitoring, addressing the barriers after the barriers have been identified, using that documentation in within the organization.